Hi everyone. Just give it another minute or so for the attendees to join, but thanks to everyone who's joined so far. Roger, I don't know if you can hear, I can hear kind of like, sounds like wind blowing noise. I'm going to mute myself in case it's me.
It might just be my computer whirring rather.
Oh, right, okay, maybe, yes, maybe it's that. You've asked it to do some hard piece of analysis.
I'd love to say that that's the true. It might be an old bit of tech. It might be the honest truth of that.
Okay, I think that's a sort of attendee. People coming in seem to have stabled it now, so we'll just get started. Thanks everybody for coming today to the Morris Block seminar. I'm Ruth Dundas from the Social and Public Health Sciences Unit, and I'm really pleased to say we've got Roger Halliday with us today to present. And he's the Chief Statistician at Scottish Government, and he's also the CEO of Research Data Scotland. And we're also really fortunate to have him as an honorary professor at the University of Glasgow as well. And Roger's worked in a whole range of statistical and policy roles in both the UK and Scottish governments, which he may touch on today, he may not. And in terms of his role as the Chief Statistician, that's overall responsibility for both the implementation and coordination of the professional statistical standards across Scotland. And so that ensures that the stats are produced free from any political interference. And as CEO, as I say, of Research Data Scotland, Roger leads the kind of like the vision there to promote and advance health and social wellbeing in Scotland by enabling this sort of access and linkage of data about people, places and businesses, and that can be used for research for the public good. So that's an introduction to Roger. I'm just going to hand over to him now to get started, and he can tell us all about Research Data Scotland, hopefully. So thanks, Roger.
Yeah, I will do my best. So thanks very much for your interest and for coming along to the session today. Like Ruth said, I'm kind of I've got these two roles at the moment, and the role as the Chief Statistician means that I'm responsible for the numbers that come out of public bodies, their trustworthiness, their quality, but also making sure that we get value from them. And so I'd be want to say something about that in both the role as Chief Statistician and as the Chief Executive of the new organisation, Research Data Scotland. So essentially, many of the things that we are doing, or the problems that we've got in government, in the public sector today, are multi-dimensional. The things at the interfaces between services, between traditional boundaries. Indeed, you know, this is the Morris Block lecture and seminar. A lot of his work's been at the interface between social, cultural, physiological. It's all about the barriers, the boundaries, and how we make connections between those. Because to solve these challenges, like inequalities, like child poverty, net zero, whatever it might be, it requires a lot of collaboration. And that's collaboration between people, between ideas and cultures, but also collaboration between data and evidence, a common evidence base, and that's pretty hard to do. So today, I want to probably say something about data-driven innovation in the public sector more broadly, but then what's Research Data Scotland going to do? How's it going to help this? How's it going to help us as analysts, as researchers, to create value and to save time, money and lives with data? The first thing that I would be saying here is about the data infrastructure that we need here in Scotland in order to be able to create that value and to create the connections between different data. And I see this in three layers. So the first layer is that kind of some of the things that you don't really see necessarily on a day-to-day basis as researcher or an analyst, but they need to be there. So an ethical approach, a legal framework, and approach to information governance and cyber and data standards and things like this. They all need to be in place. Otherwise, we just we're in real trouble. But then building on top of that, we need to have a creative zone, a productive zone where innovation, research and development happens, and in particular, a space for cross-sector collaboration. And again, there's a bit of that Research Data Scotland will be enabling, as well as a bit of the foundation there. And then and only really then can we do the innovation and research that enables some of the positive outcomes that we want to see for the people, businesses and places in Scotland. I just want to start with an example of where I've seen data-driven innovation really making a difference and how we add layers of value to the data that we have. So as Chief Statistician in Scottish Government, we've been collecting, publishing data about homelessness for many years, for about 20 years. And that's we sort of get data about individual applications for homelessness and a bit about the families that concerned there and what happens to them. And those numbers of homelessness applications sometimes go up, sometimes go down. We've been reporting that for many years, but haven't really done much with the data. But actually, when we within Scottish Government organised our own data and put the 20 years worth of data together, we found out rather shockingly that 400,000 people, 8% of the population of Scotland, had been homeless at some point in the last 20 years. And I see a lot of quite shocking statistics from time to time, and this is definitely one of the most significant that I've seen, because that's a big number in my book. But then that's just organising the data within ourselves. Actually, where some real power comes is being able to connect it to other people. And one of the things that that we did actually in conjunction with an academic team in the University of Glasgow was to link data from local governments on people who are applying to be homeless with data from the NHS on their healthcare. What that showed was, as you're probably not too surprised about, that people's experience of homeless people's experience of accessing healthcare was really not great, particularly on primary healthcare, screening, and other things like dental and eye care. And so that was, and that the people homeless have got a really quite a low healthy life expectancy and life expectancy. That in doing that work, it was quite clear, actually, when you started putting pieces of data together, that there was some really quite clear predictors of homelessness, and in particular, people that were out of work and then or lost a job in particular, and then presented at the GPs for alcohol, drugs, mental health problems. That sort of combination of things accounted for around 50% of people that became homeless or their families, and that also domestic abuse accounts for about a quarter of people that become homeless. So that piecing together bits of public sector data can really help us understand what are some of the drivers for some bad things happening. And I've drawn a line then above that, because all of the stuff below the lines, really excellent analysis, really excellent research, but that's at that point, that's all it was. it hadn't actually stopped a single person becoming homeless, but actually this was done in development with a range of frontline clinicians and service managers, both in local government and in the NHS, and that led to a particular trial of a preventative intervention where you'd come to your GPs, and if you were presented with mental health problem, drugs or alcohol, then some further screening happened, and that potentially led to you being offered support to avoid the need for avoid becoming homeless. And indeed, it showed that, well, it worked. Fewer people became homeless. Their health improved, as did other aspects of people's lives, and that it actually saved the exchequer money overall, because we were coming in early and preventing something bad from happening. And so it's really that I was just interested to explore then some of the things that happen to drive those positive outcomes. In fact, more broadly, where I see data-driven innovation happening and actually leading to saving time, money or lives for people, they're in these four scenarios. So the one just talked about there is preventing uneven outcomes from happening, predicting and preventing bad things from happening. But we've also seen quite a lot of times where there's repetitive tasks happening, and that there are sort of more efficient ways of doing things, such as on the census, the population census, which filled in relatively recently. There's when it was done on paper, and there's still quite a sizable amount that's done on paper. There was the ability to write in what occupation you were and the industry that you worked in, your employer. All of that needed coding up, and using natural language processing really was really good, and really sped that up, and had saved around about £1 million from the census, because it was a repetitive task. And similarly with complex problems such as child poverty and care for children that children in the care system, for example, complex problems that have many drivers for them. This is exactly where I've seen data-driven innovation making a big difference, and also empowering others, giving people the data in which they then drive change. I've definitely seen a number of cases where publishing open data in open formats for very local areas has really driven community engagement and communities to bid for, secure money and transform their communities. So I see that these are the four areas where data-driven innovation can really make a difference. But that I only really see it being successful where a set of things happens, and that I suppose key to this. So just reflect upon that health and homelessness example, is where you have the right group of people involved, and where it's partnerships of academics, public sector analysts, experts in the data, but also people that run services and people that would need to change the way in which services operated in order to either make savings, to put in new services. There needs to be some business change there in order to make real change happen, and that means really understanding the problem, really making sure that you've got the necessary data together and are clear about what the data product that you're going to use is, but then have the group of people there that can do the business change, the process mapping, the training, system redesign. And where I see it happening really quite well is where that is done in iterative ways, and using the data to understand actually how well is this actually working. We know how it's going to work in practice, but in theory, but how does it actually work in practice? So I think that's some general messages for me for how we as researchers, as analysts, can make a difference, and it's by making connections to people that are experts in data, people that are experts in the delivery of services, and it's about building those partnerships. So let's just come on then to more broadly where I think Scotland is in the use of data. So we've got some fantastic assets here, actually. One of the things I see as chief statistician is that we've got fantastic data. We've got lots of great academic expertise. I'm sure much of it on the call today, and we've got the ability to bring people together in those partnership that I mentioned that really drive change, and also the scale of Scotland's really quite good for testing, developing new approaches. But the difficulty being is that lots of this just takes too long to do. And so the example that I gave about health and homelessness there, from the idea of someone saying, oh yeah, actually we'd probably be really good if we could link up data on homelessness with data on health, to actually getting to the point where something was actually being tested in the NHS, never mind the research bit. So it took a number of years, and a significant part of that was persuading those who own the data to say, yeah, actually, it'd be all right to use our data for this particular research project. So, and that is partly because the data is not brilliantly organized. It's partly because the processes that we have for accessing data are quite clunky, and it's partly because actually lots of our data, it's not visible what data we have in many cases. So I think there's some significant challenges there. But if we solve those challenges, there are some really massive benefits here. So, you can see here, these are sort of relatively, I mean, I've seen different numbers that represent the numbers I've showed here, but essentially they all tell the same thing. There's a massive benefit both to the economy and to the public sector. And part of that is through attracting high-paying jobs into Scotland. And of which now we raise our own revenue from jobs, so that's a really important objective of government as well. And so more broadly, in data-driven innovation, the government in Scotland's got the ambition to move from situations where we've got great examples, a few great examples, to where data is systematically used to improve decision making. And really, it's about saving time, money, and lives with data. So where does Research Data Scotland fit into this? Well, we've been linking up and trying to improve access to data for some time. We set up in 2014 a collaboration, Scottish Informatics and Linkage Collaboration Silk, that enabled work such as the health and homelessness example, many other examples, but really focused on supporting access to healthcare data, but was trying to expand beyond that. I guess the difficulty was we didn't really have that much investment in that, and the leadership of that collaboration was still a little bit vague. There were a number of partners involved, but we then just before the pandemic hit, we kind of spent a bit of time reflecting upon some of the challenges that we had, and we decided to set up Research Data Scotland. So an organisation, it's a company, but it's a charity, distinct from government, and that's really to give the whole system of access to routine public sector data, some leadership, being clear about the offer to our users and researchers who want to access data, and really using that company to secure investment, not just from government, which thankfully we've got £5 million per year from government for the next 5 years to help us to do that. And so quite a big investment, but from other research councils and from others as well. And yeah, it gives us the basis to really make a transformation here. And also I'll say a little bit about how we're going about that, because it's essentially the same objective as the government's there, really unlocking the value of the public sector data that we have in Scotland so that it can be used systematically to improve public health, wellbeing and inequalities, and save time, money and lives. So Research Data Scotland is an organisation that essentially enables other people to access data. It's not an organisation that's a research organisation. It's not an organisation that is going to take away the responsibility from data owners around their kind of responsibility for collecting and improving the quality of the data they have. It's more about saying, we've got some great data already, let us start enabling that to be connected around a person, place or business. Let's make that data visible, i.e. the metadata about it visible, so people know what data sets we've got and what they contain. And let's improve the service to access that data, and that's partly about making it simpler, making it faster, and then improving the sort of elements of that service. So I'll talk a little bit about that in a minute. And so we've got a whole range of partners here, because the investment that we've got in government, from government, is really about us providing coordination, alignment, simplification across the system for access to data. So the top line here, the organisations that were involved or have been involved nationally in linking up and helping to access data for many years. So Edinburgh Parallel Computing Centre, the University of Edinburgh, EPCC, have got fantastically secure computing facilities. We've got National Records of Scotland, who are able to connect people from one system, like the local government data, with the NHS data, because they've got information about all people in Scotland, population spine, that helps us to do that. And Public Health Scotland run a service called IDRIS that many of you will be aware of or be users of, that enables access to data. And Scottish Government, I guess, owns some of the policy around this. Then we've got a number of organisations that we're partnering with. So we're looking at how we can connect data between Scotland that we hold here in Scotland and data that's held by UK-wide organisations, in particular the Office for National Statistics, and through them to the Department for Work and Pensions, a lot of data about people receiving different benefits, and also the HMRC, because they've got data on taxation about individuals and about businesses. And we're testing that process out, that connection out at the moment around business data, but it's really about testing that connection. The other, and the bottom row here, you may be using some, we've got 4 what are called regional safe havens here in Scotland. So they're very secure computing environments that are aligned with particular parts of the NHS, and there are collaborations between the NHS and universities in Edinburgh, Dundee, Aberdeen, and Glasgow. And so that's that. Those are our partners, and you know the regional safe havens is really about aligning the access to data and some of the data sets that we have to be able to combine some granular NHS data in different parts of Scotland and align that with some of the national data that we've got, both on health but also on other issues as well. So I won't say too much about this actually. So yeah, I mean, I suppose really that we've got the ambition of widening the range of data, speeding up and simplifying access to that data, and then doing that in ways that are open and transparent and improve the value for money, and make it easier for those that own data and control data to enable their data to be used more broadly. Public trust is really important, clearly, because the data that I'm talking about here is personal data in a lot of cases, and that the principles that Research Data Scotland is founded upon are the ones here. So everything that we do is going to be to enable research in the public good, and I can maybe say a bit more about that if we have time at the end. And the system that we've got in place to connect data around a person, place, or business means, because we're using the National Records of Scotland to do some of that, means that no one sees both the identities of people or businesses and any data about them. So yeah, that data is split up into the identifiers go one way, and the data about somebody's health or education or whatever it might be goes a different way. And then when that data is held by the Edinburgh Parallel Computing Centre, data doesn't leave there. People access data, researchers access data in that space. And the only other one that I wanted to mention is that a number of people have asked me about, can they be excluded from the data, or is this an option that's open? It's could be somewhat difficult to set up, but that's something that we're currently investigating how we do. So we're working towards citizen choice being part of this, recognizing that there'll be some situations where it's really important to have 100% of people's data. And then the other part of trust is about engagement with the public. So very committed to having public views central to how we develop and as a part of the research that we enable. And really where that comes down to is testing the public's appetite to use data in perhaps ways that we haven't done before, And when I've spoken to public panels and done some range of engagement events about this, generally people say, well, if it's data that's in the public good or public interest, that why isn't this data linkage happening already? But they also want to be really absolutely guaranteed about their own privacy and the security of that data. I think we can very much do that. We've had quite a lot of external accreditation of the security of the settings that we hold data in. And an important part of this is that transparency. So who's using what data for what purpose, and when have they got access to it? And what happens as a result of having access to it? Where we are now is that we launched in COVID. It's actually almost 2 years ago. A Research Data Scotland pilot service that included the ability to access 35 data sets that were mainly healthcare, but also the 2011 census, some data around children. So we've got a range of education data and children's social care data. So there's a range of data sets that actually have been really well used. So we still have more than 500 current inquiries, and we're able to turn those around pretty quickly. Most of them, because most of them are relatively simple. Some of them are anything but, and so I'll come on in a second to talk about some of the processes that we've got around that. And like I say, the ambition or the priority order for what we're doing. So the number one thing is that we're focusing on faster and simpler access. It's what I hear all the time from researchers. I'll say a little bit about that. But at the same time, as doing that, we're widening the range of data that we're going to be able to make available, and creating some new data assets. And I'll say something about that as well. And then once we've done those things, then we'll be in the space to develop some new services. So one of the things that I'm looking at in particular is the ability for public bodies and charities to help understand the difference that they're making with particular cohorts of people offer particular programs, for us to be able to get information about who they've been working with, and then as a result be able to understand the extent to which the interventions that they've made have affected a number of different outcomes. And then another service would be the ability for people to bring their data and connect that in with existing public sector data sets. But these are things that we'll develop in the future. They're not available just yet. And so really we're looking over the 5 years that we've got funding to be able to move from a real sort of focus on the partners group that I showed earlier on to a wider group of people in Scotland, links across the UK and internationally. I talked about a couple of new services that I was thinking that we would be developing in terms of our users, really moving from mainly focusing on healthcare researchers, but continuing obviously to deliver that service, but really building into the how we can link healthcare and non-healthcare data space, and to work with not just academics and government, which is mainly and the NHS, which is the main users at the moment, but look at how we connect with public sector, third sector and private sector organizations. But of course, this is just for data in the public interest. I'll just say a couple of things before we finish. First of all, in terms of the data sets that looking at, this is our sort of 5-year data strategy, and it's really based around there are some core national data sets. I mentioned we've already got some vital events data, we've got census data, but also a range of other really sort of core data sets. Then a set of kind of themes around equalities, vulnerable people, inclusive growth, health and well-being, and protecting the environment, which we will reach out to people, understand priorities for new data that people will be using on a regular basis, and essentially come up with a plan for bringing some of those things together, and that then will bring together some data sets that are a combination of a number of data sets that are already kind of in research ready forms, and that will be used regularly. And so there may be particular cohorts of people who have got mentioned care leavers and ex-offenders and children here. And so one example of this is around equalities. So we've got rightly criticised in COVID for our data on ethnicity, in particular around the effects of COVID, was just not up to scratch. And well, there's a range of work happening about that. One of the pieces of work is around how do we use the data that we already have to improve the coverage and our understanding of protected characteristics for people. And so we've pieced together currently a range of administrative census data sets into a protected characteristics research data set. And the aim then, our kind of next step here, is to link that to a public sector organization's data, and to help us, or help that organization to understand the extent to which access to their service and outcomes from the service are equal or not, as the case may be. And the aim then is to help that organization to make better decisions and to make their services more inclusive. So that's that. And then, so this is a picture of the data sets that we've got currently. Like I say, most of these are in the health space. One of the data sets that we're launching next month is around medical imaging, imaging data. But really, over so the dark green ones represent the data that we've already got, and the light green represent the data that we're currently pursuing, and the brown, the grey is the ones that we're just starting to work on. So our focus for the next year is going to be on post-16 learning, homelessness, adult social care. But there's going to be, we're taking on somebody to particularly focus on health data and what new health data sets we might need to bring together. And she starts at the beginning of May. So there's going to be more detail that I will be able to give in a couple of months around that. And so I've got a few minutes left. Yeah, what we wanted to, so this is the process by which researchers access data. It's quite a complicated process. In fact, this is just, you don't need to see the detail, but each of these dots represents a touch point for either the researchers or the green, sort of browny green ones, and then the people behind the scenes providing the service of the blue one. So it's quite a complicated process, and we wanted to simplify that. So we've been doing quite a bit of work with users to look at how we can do that. We've now got a metadata catalog that find researchdata.scot. If you want to go and look at that, that gives details about all the data sets that are available to access. We're looking to digitize the application process and to also to develop the analytical environment in which you access data, and also to develop synthetic data versions of all the data sets that we have, with the intention that if you're a registered user of Research Data Scotland, you can go on, play about with the synthetic data, work out whether that's that's a data that's going to really help your research question, and develop code while access to data is being set up. And the final thing that we're doing is around information governance. So it's one of the last things I'll say, and recognize that the process for access to data through the permissions that you need are absolutely required. So some kind of independent scrutiny of each research project will continue to be required, but that it needs to be perhaps more proportionate than it currently is. And we've got an international framework, the 5 Safes framework for how we do this. And like I say, that's about keeping the data safe. It's about making sure that only secure researchers can see that, and that we've got good processes for access, for holding the data, and for making sure that the outputs that come from the data won't compromise privacy. So we've got that, but what we're looking to is simplifying that process so that not everything will need to go in future through some of our public benefit and privacy panels, and then we're also working with them, the panels themselves, to make that process simpler and remove some of the duplication that we've got in the information that we ask for from researchers. And so the only final thing that I would say is about unlocking the data by firms. Currently, we don't allow this, because I think the main reason is that we haven't really got a clear policy on this in Scotland, but that's changing. Today is actually the first meeting of an independent advisory group that's going to come up with what that policy needs to be, and that what I'll be then doing in Research Data Scotland is using that high-level policy statement to develop some frameworks and guidance for working with industry on this. And again, this is really all about where industry uses data where there's a clear public benefit of doing it, and that's be one of the independent expert groups. One of the outputs from that will be more work on what public benefit really is. So I think that's it really from me. I think there is a massive opportunity here, because the value of our public sector data in driving economic growth, in improving the number of high-paying research jobs that we can attract to Scotland, and in improving saving money to the Exchequer, as well as saving time, money and lives for people in Scotland, is pretty immense. I'm quite excited, in fact, probably a bit overexcited about the potential for Research Data Scotland to help with this. We need to do that in conjunction with all the users of the service. So I would finish off by saying that if there's something that you're interested in working with us on, that is in the space of connecting data between different systems, or access to data, some of the frustrations that you might have had in doing that, then I'm super keen to work with you on that. And by all means, I'll put my contact details in the chat, and then we can go through that. But I'm conscious that there haven't been following the chat as I've been talking, but there could well be some cute questions. So I'm very happy to get into that right now.
Thanks, Roger. That was great. And you're right, there are some questions. So just before we go to the questions, just imagine the round of applause you'd be having if you were in person. It's always a strange one. I know we've been doing it for a couple of years now, but it's always strange to do a presentation from somewhere remote and then feel, has anyone actually been listening? But there's been lots of questions, so people have been listening, so that's great, and they're all clapping now. So thanks, Roger. There's a few questions about, I'm going to try and take them together, about the data and what data are linked and what are ready. So there's one about what's the current state of play with linking HMRC and DWP data in Scotland. And then there's another question about embedding the primary care data into linked data sources. And then another question about priority for data sets for non-health sector linkage. So that's all about kind of like linkage. So that was a kind of romp through those questions.
Okay, well, I touched a little bit on the priorities for us. And, you know, I think our focus is on twofold. One is the data sets where the data controllers are based in public bodies in Scotland, and the focus for this year, as mentioned, is going to be on post-16 learning, homelessness, the justice sector, and like I said, there's going to be some work starting in May around other healthcare related data sets. As you mentioned right at the beginning, the data from the HMRC and DWP is really high value to us. So there's and it's been a difficult tale of how to access this. The DWP and HMRC have both been in the past victims of data losses and data breaches, and therefore their processes are extremely tight. We've been working with them through two routes, and that is to get access to data directly, and we're working with them on getting a data set called the Children in Low-Income Families data, and also there's a data set called the Longitudinal Educational Outcomes data, which links up those leaving apprenticeships, college, university with their lifetime earnings. So there's a couple of data sets that we're expecting to make available very soon. That more broadly, where we're working with the Office for National Statistics, they've got lots of expertise in working out, because these are really complicated data sets, and there's a lot of them, in working out what data out of all the stuff that DWP and HMRC have got, what is the most useful for researchers, and how do they organize it, how do they pull that through? And so what we're doing in Scotland is, in Research Data Scotland, is setting up systems so that we can connect the data that we have here in Scotland to data that the Office for National Statistics can curate, of which that is starting to include DWP and HMRC data, but it's not quite there yet. So I just want to set up that connection so that we can link up to HMRC and DWP data in due course. But I think that realistically, something beyond those two data sets that I mentioned from DWP, that's not going to be, we're not going to do that this year. I'd be really surprised if that moved forward faster. So I think that's probably where we are on the data sets.
Okay, and you talked a bit about, one of the questions about priority data sets, so you did talk a bit about priorities and different things. How did you determine those priorities? The priority for Research Data Scotland, or have you been speaking to researchers with good research questions, or policy people who are interested?
So there are a number of routes that we've been doing. So we have a user forum meeting every quarter at Research Data Scotland. The next one's on the 17th May, and using that forum and the members of that forum to get a view on that. So that's part of it. We've also, well, I'm also currently the co-director of the Administrative Data Research Scotland programme, and through that, and the University of Glasgow is one of the partners as part of the academic part of that programme, and so we listen to what we listen to the different academic partners that are part of that programme, but also so that there's a bit about the demand, but then there's also a bit about, well, we're just looking across the board at the available data sets, and actually some data sets are easier than others to get, and so some of it's a more kind of tactical thing as well. So for example, some data sets are there needs to be quite a lot of work happened, so like changes in the terms and conditions for which those data are collected, for example, before that data can actually be shared, there's a legal basis to do so, and that will take time, but we know that some of them are set up in ways that we can make available sooner, so part of that's a tactical thing as well.
Okay, thanks. There's a couple of questions about sort of identifiability and anonymization, and that introduces bias. So the first question is, if there's no opt-out, how do you ensure non-identifiability of small subsets, so a gender clinic patient who lives on an island? And then the second question about that is, what do you think the ideal balance lies between protecting the individual privacy and also being able to investigate errors arising from linked data?
Yeah, no, so both of those are brilliant questions. I think that, so I'm quite clear that where it's personal data, that data will have to be disclosure controlled before it goes out. So there are limits in what research can be about, and if it's very, very specific subgroups, that data is not going to be able to leave or the findings about that data are not going to be able to leave the secure setting. What I would also then say about the balance between protecting individual privacy and be able to investigate errors, while the researchers won't know who people are, researchers will be able to potentially spot data quality problems, or and what we're keen to do, though it's not really set up yet in a formal way, is to have a system by which researchers can feed back kinds of problems that they're finding with the data to the data owners. I guess it would then be there for the owners of the data to decide what to do with that, but it would be within the confines of not identifying individuals, but of outlining in broader terms some of the data quality problems. So just trying to build in some kind of feedback loop, essentially.
Okay, thank you. There's a question about tracing provenance. So one useful way for us to understand what data exists is to see other people's work and see the provenance of their analysis. So, and also which data sets they use. And the person says, I assume this is also useful for you to understand what's being used and how. So what are you doing to trace provenance in the data usage?
So the way that this currently works is, and will continue as far as I'm concerned, is that for a particular research project, a researcher will be provided with data in a specific project area that only they will have access to. That data will then be held on after and stored securely in the format that it was used for research for a number of years, and that then if others wanted to come on back and do further research on that particular data set, then they could apply to and potentially get access to exactly that data. So that's how we're planning to operate things.
Okay, thanks. And there's another question. How do we manage the expectations and enthusiasm for innovation with data, with the reality of the complexity of working with novel data sources? For example, they've given us social care, and the real need to understand these data before embarking on any sort of analysis and modelling.
Yeah. And again, it's a super question. I think what I'm keen to do we've got is to essentially have a pool of experts in sort of data experts that can advise. So we'll be doing, and this is already in place through the Ministry of Data Research program, particularly around sort of children's data, is to do some training around new data sets when they become available, but also have a set of experts that can advise researchers on some issues on about working with particular data sets. And obviously we've started providing some metadata about data sets as well. And I think so part of it will be the metadata solution, part of it will be expertise, and part of it will be training.
Okay, thank you. There's just maybe a final question about the kind of like the process of accessing data in safe settings, and one's about the relationship or the difference between the kind of like IDRIS, Public Health Scotland, and the PBP process and Research Data Scotland. So how do they, I suppose, how do they differ, and does it depend on the data being accessed?
And apologies for not being clear, that essentially, so Research Data Scotland, the companies owned by the University of Edinburgh, the Public Health Scotland, Scottish Government currently, and we're in discussions with other universities. But essentially, the IDRIS team is part of Research Data Scotland. We commission IDRIS to provide services to access data. They're Research Data Scotland's kind of at the moment sort of behind the scenes, sorting out, transforming the service. I think we'll think further about the branding that we've got and how that covers the services that we develop. But essentially, it is the same service. The IDRIS team are the ones delivering the researcher service.
Okay, and this is just for my own interest. Will there be more resource put in then towards the IDRIS thing as this work comes on board and people are more excited about using data? Because that can be one of sort of like the blockages and causing the frustrations in the timelines.
Well, so there's two parts to that I would suggest, Ruth. One is that so the service is a paid for service, right? So it will raise revenue, but we're also being funded by a range of research councils as well. So there's probably elements of that service that we can account for elsewhere. But the aim is to simplify processes, to reduce cost in the delivery of services, and to reduce effort all around. And the aim, therefore, is that to kind of redefine the service. So we're going to need to do a bit more work on exactly, and we're kind of right in the middle of this at the moment, how that IDRIS service will change to change for the better. But and what the costs of that will be, given the investment that we've got from elsewhere. So I think there'll be some changes coming. We're just working through, and we should have over the coming months some more details on exactly what that will look like.
Okay, thanks very much, Roger. We're now a little bit past time, so thanks to Roger for telling us all about Research Data Scotland, getting us more excited about data that are coming and hopefully coming soon, that can answer our research questions. And also thanks to everyone for coming to the seminar and asking the questions. I think we've had a good discussion at the end. So thanks everybody, and thanks again to Roger.
Pleasure, thank you.